Dear friends, my name is Dr. Igor. I'm clinical oncologist practicing since 2010. Let's talk about post-COVID, long haul syndrome, and let's talk about post-vaccination syndrome after COVID, and in general about the chronic fatigue syndrome, because there are many similarities in all these conditions. For example, overlap between the post-COVID syndrome and post-vaccine syndrome is due to the persistence of spike protein, the main protein of COVID, which it uses to grab our cells and to get inside. And this thing may really persist for a long time. It may get into the cells, immune cells, and they cannot do anything with it. It just stays there. It just irritates them all the time. They want to get rid of it. They say, okay, we need inflammation. We need to remove this from me, please. But it avoids the mechanisms of digestion by the cell, and these immune cells will support the chronic inflammation and chronic damage to the tissues and edema, and depending in which organ it is, it will cause the symptoms. For example, in lungs it can cause chronic pneumonia, it can cause shortness of breath, cough, exercise intolerance. It can stay for a long time in monocytes, in microglia, in neural system, for example, and the patient will have neurologic symptoms like fatigue, malaise, brain fog, loss of concentration, loss of memory, insomnia, vertigo, depression, problems with smells. It can cause encephalitis. It can cause the damage to the peripheral neural system or autonomic neural system. Autonomic neural system will control our organs, for example, heartbeat, work of our other organs, or vessel tone of the guts, and it will cause arrhythmias. It can cause problems with blood pressure, low blood pressure, or changes in blood pressure, or when the person starts to do exercises or move, he will have a very high pulse rate. Also can be problems with guts, for example, diarrhea, nausea, vomiting, bloating, with the skin, itching rashes, with the mucous membranes, for example, runny nose, sneezing, itching, burning in the eyes. So you can see a lot of different symptoms. The other mechanism is the antibodies against spike protein that our body makes to remove or neutralize spike protein, but the body also makes antibodies against antibodies, and these antibodies against antibodies, they can attach these antibodies very well, and these antibodies can attach spike protein. That means these antibodies, they look and behave similar to spike protein, and this is already autoimmune condition when our immune system causes all this stuff, meaning if the person, for example, has no spike protein already in the body, he will have these autoantibodies that will cause the post-COVID long haul syndrome. Also, there can be some vascular problems, microthrombi, and we also need to check for the blood coagulation and for D-dimer. D-dimer is the indicator of how much thrombosis is going on in our body. That's why when the person has a suspected post-COVID or post-vaccine syndrome, or just general chronic fatigue syndrome, we need to do some test for him. Of course, it must be the complete blood tests, just usual blood tests, or biochemical blood test, coagulogram to see the coagulation, then D-dimer to see if there is any thrombosis, C-reactive protein, which shows the inflammation. Ferritin also shows inflammation and activity of macrophages. And macrophages, I was talking about the mast cell activation syndrome before. This is the immune cells which are having the spike protein, and they release cytokines, and they cause this different inflammation. They can cause symptoms like looking like allergy, but there is no real allergy. That's why the person must go to allergologist if he has allergies. If there is no allergy detected, that can be mast cell activation syndrome, meaning there is no real allergen, there is no real allergy. That is only because these mast cells, the immune cells, they are very irritated, and we need to calm them down somehow. We need to remove the spike protein from inside. We need to find triggers that make them irritated and make them release the cytokines. And we must remove these triggers, maybe low histamine diet, because they will release histamine. Also, we need to do early morning cortisol. We need to check for thyroid gland. We need to check for glycated hemoglobin. Some autoantibodies like anti-nuclear or antiphospholipid antibodies. We need to check for vitamin D levels and for activated herpes viruses. Some patients may need, for example, checking of the heart, EKG or echo KG, ultrasound of the heart. Some patients may need, for example, chest X-ray or brain MRI. It depends. So what should we do? How can we treat this condition? Treatment may be quite long and quite difficult, but still there is a real chance to get rid of this. And by the way, if it's a real post-COVID, it will decrease with time. So first of all, we need to get rid of spike protein. How do we do that? We know that ivermectin may help with that. It will remove the spike protein, it will help with inflammation, and it will help with autoantibodies, with autoimmune components. So it's a very good drug for post-COVID. And many people, they say that it really helps them. Also, in some cases, the detoxification of the gut and blood may help. For example, they can take some absorbents to remove the substances from the gut, and they can take some herbal remedies, for example, to stimulate the urine flow, and so the kidneys will detoxify the body. First thing is activated charcoal, for example. Second thing is orthosiphon, the herbal remedy. One more thing that can help is intermittent fasting, because during intermittent fasting, better 16 hours fasting, it will activate autophagy in our cells, because hungry cells, they will start to eat the contents, the debris, the garbage inside. And this garbage is spike protein. And these mechanisms are different. That means that autophagy is not active in normal non-fasting cells, and that mechanisms don't really help to remove the spike protein, but autophagy can really help. Also, the moderate sunlight exposure may be good in the morning or in the evening. We need the red or in almost infrared lower spectrum of the light, of the visible light, I mean, that can be absorbed by our skin and our tissues quite deeply, and it may actually increase the action of mitochondria. Why am I talking about mitochondria? Because mitochondria is the energy plants of our cells, and often during COVID or during many other things, the mitochondria may be dysfunctional. And if they don't produce energy, of course, you can guess, we won't have energy in our body. That's why sunlight may help. Also, methylene blue may help, because it's a blue, it's a dye, and our mitochondria have a chain of substances through which the electrons will run and produce energy. And the fourth substance is chromophore, meaning it's colorful, and it's like something like what the plants use to absorb the light and to produce energy. So methylene blue may help with the energy production in mitochondria in our cells. So visible light, the red spectrum, and the methylene blue may help with the dysfunction of mitochondria. And also we know that coenzyme Q10 is also the component of mitochondrial electron transport chain that is also important for production of energy. That's why intake may also help some people. What else? A low dose naltrexone. It can help with removal of spike protein, with immunomodulation, with decreasing of inflammation and edema, and it is also one of the main drugs, most important drugs to treat the post-COVID syndrome. The other important things are, for example, aspirin, melatonin, resveratrol, for example, prebiotics, probiotics, vitamin D. But all these things might be prescribed individually by the health professional. And don't forget that if somebody is taking methylene blue, it shouldn't be taken with curcumin, Nigella sativa or black cumin, and also the antidepressant drugs of the specific group, which is called selective serotonin reuptake inhibitors. Difficult name, I know. See the drug information if you are taking one of antidepressants to see to which group it's included. Dear friends, that's all for today. I hope it will be helpful for someone. Don't forget that there can be some contraindications and you should always talk to a medical professional because self-treatment may be quite dangerous. My name is Dr. Igor. Thanks for your attention. See you in the next videos. Bye bye.